Hello, my name is Brian Moores. I am a weight loss surgeon at Bariatric Medicine Institute in Salt Lake City, Utah. Congratulations on making it to your pre-op visit with our group. Today I'd like to just summarize some of the pre-op, hospital, and post-op care for your weight loss surgery. The goal of this video is to briefly summarize some of the common questions that we get asked during this visit and to serve as a resource for you moving forward if you have questions. Your best resource for questions, though, is the guide provided to you by our office, as it has the most detailed information. So the first thing that you'll be asked by your provider during your visit are a review of your heart and lung issues for the anesthesia providers at the hospital. It's important to be very honest with your provider during your visit, as undiagnosed heart or lung issues or complicated heart or lung issues without appropriate workup can cancel your surgery if we don't plan ahead. So make sure to bring these issues up with your provider so that we can clarify that they've been addressed. The second thing that your provider will go over is your preoperative labs, and they'll review if you have any deficiencies that we need to start you on supplements for prior to surgery. Very rarely, patients can have severe iron deficits or severe anemia that may need to have surgery delayed. Don't worry if this happens. It's uncommon and often it's easy to reschedule. The next thing that your provider will go over is your home medications and new prescriptions. In general, your provider will review all of your home medications and which medications you can continue to take after surgery, which medications you'll decrease or stop taking, and if you take any medications like Wegovy, Mounjaro, or any of the other weight loss medications, when to stop them as well. Regarding new medications, we'll be prescribing about 9 new medications to you to help before and after surgery with different symptoms. We send you detailed instructions on these medications and how to use them, and I'm going to briefly go over them. Before surgery, at this visit, we'll be prescribing you these 9 medications, and you'll be responsible to pick these medications up from your preferred pharmacy before surgery. In general, I recommend that people print off the instructions for the medications, obtain all of their medications, and put them in one bag and bring everything with you on surgery. This prevents people from missing medications or not having medications available when they go home. Before surgery, we recommend 4 medications 2 hours before surgery. It's 2 tablets of Tylenol, 1 tablet of celecoxib, 1 tablet of Lyrica, and 2 tablets of Emend. Emend is a strong anti-nausea medication, and it's very good for patients that are having same-day surgery or outpatient surgery. This medication is expensive, and it may have a high out-of-cost expense, so be prepared that you may have to pay some additional money for that. Also, Emend is pretty rare, so your pharmacy may not have 2 tablets. They may only have 1, or they may have none. After surgery, we prescribe about 5 different medications to help with different symptoms. For pain, we prescribe Tylenol, Lyrica, and oxycodone. Some patients that are elderly may get overly sedated with Lyrica or may experience some side effects such as tingling or numbness or brain fog. If you have severe side effects, you may want to discontinue Lyrica. It prevents nerve pain. Oxycodone should be used sparingly and only needed for breakthrough pain, as it can cause constipation and sedation. For nausea, you'll be prescribed dexamethasone and Zofran. Zofran is a stronger medication that works acutely, and dexamethasone is a mild steroid at a very low dose that can help with some chronic inflammation as well as mild nausea. For stomach spasms, we prescribe hycosamine or Levsin. This medication will help decrease the severity of esophageal spasms and stomach spasms. So when you eat or drink after surgery and you have some sharp discomfort in your chest or in your upper belly, again, hycosamine or Levsin can help. And then the one mandatory medication that we prescribe is Eliquis. Eliquis is a blood thinner that you'll start 2 days after surgery and you'll take for 1 month. This medication prevents blood clots, and it's the only mandatory medication we prescribe. We do send you a link for a coupon. Make sure to fill that coupon out before you go to the pharmacy, as that manufacturer provides 1 month for free. Let's talk a little bit about surgery. Things I'd like to review are when your surgery will be, what to expect on the day of surgery, and then what the risks, benefits, and alternatives to surgery are. So we operate at 4 facilities: Holy Cross Salt Lake, City Creek Surgery Center, LDS Hospital, and St. Mark's. These facilities will call you 2 to 3 days before your surgery, and they'll tell you what time to show up for your procedure and what time your procedure is. We want to make sure that you take your pre-op medications 2 hours before your scheduled surgery time so that you can absorb those medications and prevent pain, inflammation, and nausea. Next, I'd like to talk a little bit about surgery and what to expect. Surgery for a sleeve gastrectomy will take approximately 45 minutes, and the duodenal switch will take approximately an hour to an hour and a half. You can double that time for the time that it takes to go to sleep and wake up. So on average, your family for a sleeve won't get to see you for an hour and a half to 2 hours, and for a duodenal switch between 3 to 4 hours. After surgery, you'll be admitted to the floor in the hospital for 1 day. Most patients, the first day is just about recovery, breathing deep, going on some walks, and getting up to urinate. The second day in the hospital, which is when you'll be going home, you'll start on liquids, oral pain medications, and you'll have your drain removed from your incision, which is used to monitor for bleeding or leaks. One thing that we should talk about with surgery are the risks, benefits, and alternatives. At this point, you've made it to surgery, so the alternatives are not really important to talk about today, but long term, there are alternatives to surgery, such as diet and exercise, weight loss medications, and revision weight loss surgery. Some of the risks with the surgery are generic to any surgery. So there's a 1 to 2% risk of infection or bleeding. With anesthesia, there are risks of heart attack, stroke, blood clot, an allergic reaction to a medication, or problems with anesthesia. Long-term with weight loss surgery, there's always a risk of weight regain. And this is specific to your weight, your metabolism, and what surgery you pick. Your provider can talk more with you about this risk. Other risks are developing heartburn, either temporary or permanently, or requiring additional surgery for heartburn. And then some of the most common risks, kind of in the immediate post-surgery period, are developing nausea, anorexia, heartburn. Usually medications help treat those things, but sometimes people will need temporary feeding tubes down the nose if they're not able to eat or drink well on their own, or they may need rescue IVs in the arm, such as PICC lines to provide nutrition. Other scary things are if connections leak or if connections are too narrow. That's a 1 to 2% risk. Those complications do require additional treatment and management. Lastly, long-term, for the duodenal switch, there's approximately a 5% revision rate for kind of a group of issues such as life-altering diarrhea, vitamin deficiencies, protein or iron deficiencies, developing problematic bile reflux, or again, heartburn. All right, and then some of the key benefits to the surgery are obviously decreasing your weight, improving your health, resolving high blood pressure, diabetes, and decreasing your risk of major heart attacks, as well as decreasing your risk of cancer. Let's talk a little bit about diet. So before surgery, we do recommend a preoperative diet for 2 weeks. The diet consists of a low-calorie diet, 800 to 900 calories a day, starting for the first week with 1 protein shake and 2 light meals. Again, the details and specifics can be found in your instruction book. The 1 week directly before surgery, we like patients to move to 2 protein shakes a day and 1 lean small meal. The pre-op diet is important for shrinking the size of your liver and decreasing your risk of bleeding. It's important to help you develop meal prep for after surgery, and it's also important for your body to get used to lower blood sugar levels, which can be difficult for some patients that don't normally live in the normal blood sugar range. After surgery, we have a very strict diet for 1 month. Initially, we recommend that patients do full liquids for 2 weeks, and then soft foods from week 3 and 4. At 4 weeks after surgery, patients can move on to a normal soft diet. Again, the details of this can be found in your instruction booklet, but it's very important that we don't cheat on the post-surgery diet. Unfortunately, we have had a rare event where patients have eaten solid food immediately after surgery and caused blockages of their new connections or mechanical obstructions that have led to disruption of their new anatomy, requiring emergency care as well as ICU care. Just think, if you had knee or hip surgery, you'd be doing physical therapy for a month. Your post-surgery diet is physical therapy for your stomach and new connections. So I highly encourage you to follow the instructions as they're meant to make your recovery process easy. Let's talk a little bit about wound care. After surgery, you'll have 4 or 5 small incisions on your belly, and those incisions will be closed with either suture or with staples. In general, we'll recommend that you shower daily with soap and water starting 2 days after your surgery. You may have some band-aids in place, and you're welcome to take those band-aids off 2 days after your surgery, and once you've removed them, that's when you may start to shower with soap and water. You don't need to do anything special for your incisions. We recommend patting them dry after showering, but you may leave them uncovered. Some people like to place small band-aids over them to prevent clothing from scratching on them or to catch any mild amount of drainage. Some people may have some very clear straw yellow drainage. That's healthy serum. Things that you need to call the office for, or if you start having redness that's spreading aggressively around an incision, or if you start to have pus-like drainage from your incisions, as those may indicate infection. If that occurs, the best thing to do is start taking daily pictures, send them to the office, and call us as well. Now, for your staples or your sutures that may be in place, we recommend removing the staples at the 2-week mark. You'll be sent home with a staple removal kit by the hospital. Or if you have sutures, you'll remove those sutures at the 3-week mark with the suture removal kit. If you have trouble with either of those, you're also welcome to call the office, and you can come in for an appointment to have our MAs or providers assist you in removing them. Let's talk about your follow-up schedule. In general, once patients are discharged from the hospital, we'll call you on Friday, the same week of your surgery, to check in and see how you're doing with your liquids, if you're having any pain issues, or if you've had any emergency needs. And then you'll have a visit scheduled at 2 weeks with either one of our mid-level providers, our PAs or nurse practitioners, or you may see your surgeon as well. After the 2-week visit, you'll be seen monthly with the diet and exercise team until your 6-month checkup with the provider for your labs. We do like patients to continue visiting monthly with diet and exercise until they've reached their weight goal. For patients that have had the duodenal switch, you'll continue to see us every 6 months for the first 2 years with labs to check your vitamins. And then after 2 years, we go out to every year with labs. For the sleeve, it's very similar. It's every 6 months for the first 2 years, and then yearly afterwards, also with labs. Next, we'll talk about some frequently asked questions for directly after surgery. Hopefully I've answered any questions that might have come up regarding the immediate pre, post, or intra-hospital care visit, but some things we commonly get asked are, when should I expect my first bowel movement? Well, first, everyone's different, but in general, people should be passing gas at least 2 to 3 or 4 days after surgery, and then most people should have their first bowel movement by the 4th or the 5th day after surgery. Now remember, you've been on a liquid diet for several weeks before surgery and after surgery, so your bowel movements may not be solid, they may be soft, they may be liquid. It is important to call the office if you haven't had a bowel movement by day 6 or day 7 and you're starting to feel constipated, bloated, or nauseous. It may be time to start a laxative or do an enema for severe constipation. Another question we commonly get is, why does it hurt when I eat? And remember, the stomach is a very large blender. It takes normal food, it puts acid in it, and then turns it into basically a smoothie. And when we make that stomach smaller, it's very common for patients to experience spasm. The stomach is not squeezing in a coordinated fashion, and so when you eat or drink, the stomach tends to spasm. One medication that we find useful for that is icosapent or Levsin, and you can take 1 to 2 tablets 3 times a day. That should decrease the intensity of those spasms, but it won't make the symptom go away altogether. Some people find dexamethasone helpful for that spasm discomfort as well, as it can decrease the inflammation of the stomach. Other patients ask, why am I nauseous? Nausea is one of the most common symptoms after any weight loss surgery, and the key reason is that's how the stomach communicates that it's been injured, or it's how it communicates that it's full. So nausea is a normal symptom to be experiencing, and you can expect it to get worse when you eat or drink. Again, you do need to push through this symptom and continue to drink 64 ounces a day, and we do recommend that you take Zofran or dexamethasone to help control this symptom. And if those don't work and you start having constant nausea, severe nausea, or vomiting, those are alarm symptoms that you'll need to call the office and discuss further. Lastly, we do hear that patients sometimes are getting dizzy or fatigued, and this can be a spectrum of severity. Often people can be feeling fatigued or dizzy because they're either having low blood sugars, they are getting dehydrated, not drinking enough. So it is important that we start doing 1 to 2 protein shakes a day, and that we're getting a minimum of 400 to 600 calories a day, and that you're aiming for at least 64 ounces of liquid intake a day to prevent dehydration. Again, if your dizziness or fatigue is getting to the point where you can't stand up and be steady, if you're unable to get up and even use the restroom on your own, these are warning signs that you should be calling the office and getting additional workup. So in closing, I hope that this video helped answer some of your questions for before and after surgery. Keep in mind that there may be specifics about you or about your health that may need to be discussed further with the provider, and that's the point of your clinic visit, is to go any specific details to you. This video just serves as a brief overview for the common questions and issues so that you come prepared to your visit. We look forward to seeing you at surgery, and we hope this process goes smoothly. Make sure to touch base with the provider or the office if there's anything that's unclear. Most of the detailed information can be found in your pre-surgery packet, so make sure to read and review it before your surgery.